All right, we are back here at the best online source for your residency interview preparation. And the question about how do you make your patient feel comfortable, especially if they are not comfortable, right? So this question is being asked, a situational question. All right, so let's get into it. And the ability to make patients feel comfortable is a cornerstone of effective patient care. So in internal medicine, in family medicine, any type of medical practice where you often manage, chronic conditions, building trust and rapport is essential for improving all types of outcomes. And as usual, I will be giving you a bad answer and then a good template answer to answer this question with confidence. Interviewers want to assess your interpersonal skills, your empathy, your approach, and your communication abilities. Now, they're looking for candidates who understand that comfort goes beyond clinical care. It is about creating a safe and respectful environment for your patients. The bad answer. If you are struggling with your residency interview preparation, listen to this as it may make the valuable difference in helping you match. For those of you who really want to be successful in your interviews, I have something for you. I have this extensive program that will be great for any of you. And with the first option, you have all of my videos ready with template answers, sample answers for multiple specialties for you to copy and paste and use it as your own answer. Now, this was a video course program. Now you want to scale up? Then I have weekly group sessions conducted by myself, small groups, about 12 sessions for this season. And you can have your interview ready in no time. And this will include everything in the video program. And somebody who wants one-to-one sessions with myself, I have the 3 hours one-to-one session with myself, mock interviews, and this will of course include everything in the previous programs. All right, and what will you get? You will get common questions, answers, templates, frameworks. If you are in the group sessions, then you will talk to me directly. And you will have behavioral questions, you will have ethical questions. Everything will be included. And all of this is right now going to be 50% off for a limited time, actually more than 50%. Go check it out with the link in the description. Thank you.
Dr. Umar is a very unique mentor who gives very direct and practical feedback, very kind and very expert on interview preparations and sessions, and makes sure that he prepares you accordingly so that you excel. And I hope we all excel under his kind tutelage and mentorship. Thank you.
Well, I guess I just talk to them like I would talk to anybody else. I try not to be too serious, but I don't really have a specific way of doing it. It depends, of course, on the patient and the situation. So why is this bad? The answer is definitely vague, lacks any insight into the candidate's communication strategy. Definitely something you don't want to be doing, all right? So now let me give you a good sample template answer. Thank you for asking. That is a very important question, and that is just 50% of medical care, I believe. So making patients comfortable actually begins, I believe, by building trust and showing genuine empathy. I do start always by introducing myself clearly and explaining my role and addressing the patient by name. I also hand them over my business card every time I see them for the first time. I try to establish a connection by asking rather simple initial questions, non-medical questions like, how are you feeling today? Or did you manage to get any rest? So this helps create a warm and an approachable atmosphere. I would not be hovering over their bedside. I would be at a distance, and if there is a chair available, I will be sitting down on the chair and opening up with the patient and getting the patient to start to communicate with me openly while sitting in the chair. And when I am done with getting the information that I need, and when I'm going for the physical exam, then of course I will announce that, okay, let's take this conversation, and I'm going to be conducting a physical exam. I will be explaining every single aspect of what I am doing and repeating back the signs that I'm picking up. For example, if the chest is clear on my auscultation, I will be saying, good, chest is clear. I can hear clear breath sounds. And moreover, additionally, in my conversation with the patient, if there is anything that I can relate with or connect with, such as they have a garden that they work on, and I also happen to have a garden that I look after every now and then, I would talk to them about it and share my experience and a way to connect with the patient and build trust and build a comfortable communication between us. So that is what I would try to do. Thanks for asking this question. Now, that was one answer. Now, I'm going to give you some more templates to talk about depending on your situation, right? So I would say I also would make a conscious effort to explain procedures and diagnosis in plain language. I always want to ensure that patients fully understand without feeling overwhelmed with medical jargon. For instance, during my US clinical experience rotation, I did care for an elderly patient who was anxious about a complex treatment plan. And by breaking it down step by step and checking for their recollection and recall and checking for their understanding, I noticed that the patient became more relaxed and engaged more with their patient care. And then I have developed a knack to draw out whatever I am talking about. If I'm talking about the heart, I will draw the heart. If I'm talking about the kidney or the lungs, I will draw that out. So lastly, I'm mindful of non-verbal communication. So that basically means that maintaining eye contact, using a calm tone, and being aware of my body language, always helpful. Small gestures like sitting at eye level can significantly enhance comfort. And of course, each patient is different, but I have found that these approaches do create an environment where they do feel heard and respected. This is how I will look to approach developing rapport and comfortable communication with my patients. Thank you. You always need to start these answers by addressing the question. Okay, you need to have that transition sentence, right? You have to highlight that this is an important aspect of medicine. Then you go on to explain some of your steps involved by giving an example and emphasize that you will be flexible as well. So yeah, this is how I would go about answering this question. These questions are being asked. Let me know if you want any other questions to be addressed. I'm Dr. Umar Khan. Thank you.